This is Frequently Asked Questions About Natural Migraine Relief, Episode 19. Exercise and Migraine. Is it preventive, provocative, or both? Part 2. Hi, this is Jeff Baker, your host for Frequently Asked Questions About Natural Migraine Relief. This week in Episode 19, we will finish our discussion of how exercise can affect migraines. I hope that you've had a chance to review Episode 17's FAQ post, which was part 1 of the series. We're in the middle of reviewing 6 root cause factors that affect how exercise can either prevent or promote migraine headaches. Last week, we discussed exercise, blood flow, and the role of nitric oxide, as well as exercise in the neurochemistry of migraine and exercise and the role of rest and sleep. This week, in part 2, we will consider the impact of 3 other potential root cause contributors that can modulate the role of exercise on migraines. This will include exercise and metabolic factors in migraine, exercise and female hormone balance, and exercise and your fitness level in migraine expression. As we did in part 1, I'll include action plan ideas with each of them, and then we'll summarize them at the end of the article. Please keep in mind that we could easily fill each section with 15 or 20 pages of discussion and documentation, and for the sake of brevity, I'll stay as focused, brief, and as to the point as possible. Let's begin this episode with factor number 4, exercise and metabolic factors in migraine. By its nature, exercise puts a demand on the body to achieve a performance workload. Let's take a look at how this workload affects 3 factors that might affect migraine frequency or intensity. The first is oxygen and lactic acid. Exercise can be described as either aerobic with oxygen or anaerobic without oxygen. Exercise that exceeds our ability to bring the cell oxygen in on demand can result in the production of a side product called lactic acid. Anaerobic exercise results in an excess of the byproduct called lactate. MRI spectroscopy has shown that higher migraine frequency is related to increased brain lactate levels. The bottom line here is to stay within your aerobic range as you gradually extend your fitness capacity over time. The easiest definition of this may be to avoid getting into or staying in the feeling acutely short of breath zone with your exercise. The next factor is hypoglycemia. While we would like to exercise to melt fat indirectly and preferentially, most of the time our initial energy source in exercise is glucose. Since the preferential energy source in the brain is also glucose, low sugar levels often manifest there first. Fasting, skipping a meal, or having had a high-carb meal 2 to 4 hours before an exercise session can all drop your glucose level and may promote a migraine headache. Avoid those carb swing events noted above and have a quick glucose fix of around 100 calories, such as a sports drink, energy bar, etc., available, especially if you're experiencing typical symptoms of hypoglycemia, which could include irritability, low-grade nausea, a feeling of brain fog or lightheadedness, yawning, or increased sweating as you go through your exercise session. The next metabolic factor is hydration. Multiple studies suggest that dehydration can trigger a migraine, and if you're in a cycle of headache and nausea, the resulting dehydration can worsen a migraine. In dehydration, the brain meninges can be stressed, and the resulting signaling can overlap with the cortical spreading depression event that is a key event in the migraine process. If you are already low-grade dehydrated before exercise, even a moderately intensive exercise session could contribute to a headache. It can be helpful to prehydrate with 10 to 16 ounces of water before exercise, and then sip through another 10 to 16 ounces during and after your session to stay hydrated and limit any fluid deficit contribution to a migraine event. The next is exercise and female hormone balance. There are two considerations here. The first would be where you are in your monthly cycle. An estrogen to progesterone imbalance can be a promoting factor in migraine, especially if the progesterone component is too low, which allows the estrogen to have too dominant an effect. This is usually most prominent in the latter third of the cycle in the 5 or 10 days prior to the next menstrual flow. If you have PMS symptoms, as I note below, in this phase you may be more prone to month-end migraines, including those precipitated by exercise. If you note this connection, consider using additional daily topical progesterone on the at-risk days. A physician can prescribe gel caps of 50 or 100 milligrams or a topical cream in the 20 to 100 milligram range. For reference, commonly reported PMS symptoms can include fluid retention, breast fullness or tenderness, increased appetite, abdominal bloating, mood swings and irritability, fatigue, problems sleeping, and headaches, notably migraines. You can get USP pure progesterone over the counter, although you may need 2 to 4 cc's per day of the 15 milligram per gram cream you can normally get over the counter to get enough to meet your needs. This can be more expensive at times than getting it in a prescribed form, although the over-the-counter form can allow you to begin a process of trial and elimination for the use of PMS for PMS and exercise-induced headaches on your own. You may want to consult a practitioner who understands the use of bioidentical hormone support therapy, and if you have a local compounding pharmacy available, the staff there will know who in your area knows what they're doing in this area of expertise. The other consideration regarding exercise and female hormone balance is where you are in your ovaries' life cycle. For those of you near or in perimenopause, you are most likely having an ongoing year-to-year decline in the previous baseline of all three major hormones that are in play. This includes estrogen, progesterone, and female-appropriate testosterone. This process can cause weight gain and blunt your response to exercise. Working out harder and getting less results is not usually a formula for sticking with the program. If you find that you're not only getting less out of your workouts, but are also finding that exercise is provoking your migraines, you may benefit from daily support hormone therapy even if you're still having periods. See the advice in 5A, just above, about seeing someone knowledgeable in prescribing individualized bioidentical hormone support therapy. The next and last factor we're going to discuss regards exercise and your fitness level in migraine expression. Where you are in the getting fit spectrum may play a role in how exercise may provoke or prevent a migraine. It has been shown that as one progresses to a higher level of fitness, exercise can actually reduce the incidence of migraine. But in the process of getting fit, however, there are two common exercise-related triggers for migraine to avoid. The first is insufficient warm-up. Some degree of progressive aerobic warm-up allows a graduated increase of blood flow and blood pressure in response to exercise. For those who want to go straight to the weights, you might want to first go to 5 or 10 minutes of aerobic warm-up, such as a treadmill or elliptical, that raises the heart rate and blood pressure before going to your usual strength training routine. The other exercise-related trigger factor in getting fit has to do with high-intensity exercise. As we discussed previously, pushing too hard against the boundaries of our fitness level can allow deficits in oxygen, glucose, or hydration to elicit our migraine weak links. Apart from migraine, you could and probably should press your limits on intensity from time to time. However, it can be very hard to know exactly when you cross the high intensity line that could potentiate a migraine until you cross it and pay the price. I would encourage for you to make up in frequency and consistency of exercise what you might have to surrender in terms of the intensity. Now it's time to consider some action plan considerations. This will be the summary of part 2. These are factors to consider about exercise and migraine. First, make sure and warm up before more intense exercise. If you do weights first, consider 5 to 10 minutes of aerobic warm up to gently raise the heart rate and blood pressure before you go on to more high intensity exercise, including strength training. Number 2, stay within your aerobic limits as you gradually extend your fitness capacity over time. Number 3, as it can be difficult to know exactly when you cross the high intensity line that could potentiate a migraine, it might be wise to make up in frequency and consistency of exercise what you might have to surrender in terms of the intensity you are hoping to get. Next, be extra aware that fasting, skipping a meal, or having a high carb meal 2 to 4 hours before an exercise session can drop your glucose level and may promote a migraine headache. It may be a handy thing to have a quick glucose fix of around 100 calories, such as a sports drink or energy bar available, especially if you're experiencing typical symptoms of hypoglycemia. And next, avoid dehydration by prehydrating with 10 to 16 ounces of water before exercise and then sipping your way through another 10 to 16 ounces through and after your session to stay hydrated and limit any fluid deficit contribution to a migraine event. On the hormone front, if you have monthly cyclic PMS symptoms and are prone to end-of-the-month migraines, including those precipitated by exercise, you may want to consider using additional daily topical progesterone on those at-risk days. And if you're in perimenopause, the gradual drop of all 3 major hormones in play, estrogen, progesterone, and female-appropriate testosterone, can cause weight gain and blunt your response to exercise, and the situation can also exaggerate exercise-provoked headaches. Seeing somebody knowledgeable in prescribing individualized bioidentical hormone support therapy can make a world of difference for many of the symptoms seen in this time frame, including migraine and also exercise-provoked headaches. If you have a local compounding pharmacy available, the staff will know who in your area knows what they're doing in this area of expertise. If you did not read episode 17, part 1, I would go back and review. That way, your cumulative exercise-related migraine action plan can be as complete as possible. If you would like to understand the broad range of root cause factors that drive your migraines, and then go on to individualize your therapy options, you may want to take my comprehensive Natural Migraine Relief for Women course with its unique migraine action plan system. See www.naturalmigrainerelief.online for more details.